So, hey everyone, welcome to the show. I'm your host, Dr. Joseph Kappas. Thanks for joining me. Today, I am joined by my guest, Dr. Todd Riddle of FAKTR. Thanks for joining me, Dr. Todd.
I appreciate it. Thanks for having me on.
Yeah, doing okay today? Surviving?
Yeah, we're doing fine given the current circumstances. Trying to balance kids and work, it's a challenge. I'm sure everybody else is going through, but yeah, we're doing great. Thank you.
Yeah, that must be quite the handful. But so, Dr. Todd, you wanted to talk to us about FAKTR and what it is, but I'd also be interested to know about your story and how you got started with it.
So a little bit of historical context about FAKTR. It's an acronym, stands for Functional and Kinetic Treatment with Rehabilitation, and was developed by two chiropractors, Dr. Thomas Hyde and Dr. Greg Dorr, who were, at the time of FAKTR's inception, or the idea of it, were both Graston instructors. So a lot of times people will associate our FAKTR course or our FAKTR concepts with instrument assisted, and we'll get into a little bit of that later on. But at the time that I got involved with FAKTR, I was living fairly close to Dr. Hyde. So we had decided to host him and have him teach a FAKTR course to some of the students I was teaching in chiropractic school, and was really taken by the simplicity of it, but also really how elegant the system is. So to make a very long story short, because of geographical proximity and because of how neat I thought the FAKTR concepts were, I had reached back out to the to Tom and to see if he was interested in having on more instructors, and he did. So that's kind of the long story short.
Very nice.
Yeah.
So for those who aren't familiar with what FAKTR is, you said it was kind of birthed from Graston in a way. Can you describe to us what it actually is and who it's designed for?
Yeah, exactly. So in a nutshell, FAKTR is really about a clinician seeking out a position or a movement that provokes pain or dysfunction and treating them in that position or in that motion. So for instance, if you're working with a throwing athlete and they get pain with their arm in an overhead position through the throwing motion, it would be the clinician's task to try to recreate that motion and treat them with a variety of different tools. Treat them in that position. So you could use instrument assisted, you could use hands-on approach, you could use I suppose you could use electricity. We've used laser, shockwave therapy. So the idea with FAKTR is we seek out these positions or these movements of provocation and try to treat within the context of that provocation. So there are really 5 concepts to FAKTR, or 5 positions, if you will, that could be provocative. One would be a static position. So maybe they have pain when their head is turned to the right, or maybe they have pain with their hip internally rotated. So that's where the concepts would start, from a static position, no movement, no load. The clinician's job would be to clear up the pain or dysfunction in that position and then systematically progress them along. So the next concept would be motion. So if it doesn't hurt statically, does it hurt with motion? So it's almost a bit of a clinical audit, if you will, because it becomes an assessment and then treating in the position of that assessment. So if there was a motion that hurt, you would treat there. And if that didn't provoke it, then we would load it. So we would go to resistance. Once we cleaned up the resistance, then we would really start keying or focusing on function or activities of daily living. So again, if you're working with an athlete, you try to reproduce athletic skills that may provoke pain. Or if you are working with a stay-at-home parent, reproducing potentially the things that hurt them at home. Maybe it's standing at the sink washing dishes or lifting a child up off of the ground. So we try to recreate those situations with function. And then finally, we kind of lock it all in. And I think this is where maybe a little bit interesting to your listeners would be with what we call proprioception. But I think we can expand that a little bit to really encompass not just proprioception, but really trying to lock in and drive long-term neurological change, or really to tap into the neuroplastic abilities of the brain.
Mm-hmm. And when you say proprioception,
Mhm.
um, so let's take, for example, the scenario of somebody maybe with a tight hip flexor,
Sure.
right? So, say by working on that with the various modalities that FAKTR employs,
Mhm.
how would that have a positive effect, maybe neurologically or on the brain or on movement patterns, et cetera?
So really what we're trying to do, by the time we get to that proprioceptive phase, generally speaking, I would like to see a patient out of their pain and out of their dysfunction so that we can start focusing on proper movement patterns. We're focusing on that the whole time.
Hmm.
By the time we get to the proprioceptive aspect, we should be able to start working very specifically on proper form, on proper load, challenging the nervous system by making the body, in one context, unstable. So that could be perhaps you have them standing on one foot using a body blade or what we call a wobble bar.
Hmm.
It could be doing more complex exercise on one foot or 2 feet that also has external auditory cueing or visualization associated with it. So by the time we get to the proprioceptive aspect, we're really trying to focus on changing the way the brain perceives the body and making sure that that's a long-term effect.
Right. So, what are some of the modalities that you might use in those situations?
That's a great question. There are quite honestly probably too many to list at this point, but some very popular ones, obviously, as I had mentioned before, would be instrument assisted.
Mhm.
We have utilized class 3, class 4 lasers, specifically lasers that allow contact with the body. I'm a very big fan of shockwave therapy. There's the hands-on approach, myofascial release. So there's um, NIMO, for instance. So there's a lot of different hands-on aspects, or I will call it instrument assisted, not just speaking specifically about the tools, but about any instrument that you can use to calm something down that can give afferent input into the body so that the CNS can process that. So we were really much more about the things that a clinician can bring to the table, the things that they're trained in, and then show them how to utilize that within that progressive concept of FAKTR. So I don't want to say it's endless because that would be, you know, incorrect, but there are a lot more things that you can use than most people would usually associate um, with body work, so to speak.
Mhm. Okay. You had mentioned earlier that you mentioned athletes earlier, and you
Mhm.
also mentioned ADLs. What's the breadth and depth of patient base that you have found that FAKTR really excels in helping with?
That's a great question. My professional leanings are mostly towards sports, so that's been the majority of the experience that I have had with it. But when I first got involved with FAKTR, I was still running more or less a family-based or a family-oriented type chiropractic practice that included the traditional chiropractic manipulation all the way up through very high-level exercise. So uh, at this point, I've kind of seen the gamut from, I can say, 7 to 8 year old children, all the way up to, I think the most elder patient I've treated would be at this point 90 years old, using the concept. So it can run the gamut of patients. Really, what it comes down to is proper clinical selection by the doctor or the practitioner to make sure that if you're going to use instruments on somebody, that it's safe. If you're going to use shockwave therapy on somebody, that's safe. If you're going to have somebody move, that those movements are appropriate for them. So the point here would really be that this is supposed to be a very patient-centered um, system where we, as the clinicians, use judgment to determine whether or not the movement we want to use is safe, the tool that we want to use is safe, the position that we're going to put them in is going to be safe for them. So we can really run the gamut with this.
Okay. And if I were to try to find a practitioner who utilizes FAKTR, how would I go about doing that?
So we have a couple of different websites up and running. We have factor-store.com. We have actually a directory feature there. We also have another one called FAKTReducation.com. We have a link to the directory there. So point being, we have a FAKTR directory, and at this point, if my numbers are correct, we are on now 6 continents and have thousands of instructors across the world from when Dr. Hyde and Dr. Dorr originally conceived of FAKTR, and we continue to hold dozens of classes across the world every year. We have now basically opened up many of the other continents by having instructors there local to each one of those areas. So we've been working really hard to make FAKTR, the concepts, the classes, not just available to clinicians that want to come take the course, but then also to patients who may benefit from it.
Okay. And you had mentioned that this was created by 2 chiropractors. Is it mostly chiropractors practicing this now, or has it become a little more interdisciplinary?
It's been very multidisciplinary. So even in the time that I've been associated with it, we've had chiros, we've had physios, athletic trainers, we've had some osteos, some traditional medical doctors, if you will. So we do kind of run a wide swath of practitioners that show up to class, massage therapists. But I would definitely say it's going to be your more conservative, hands-on type practitioners. So chiros, physios, massage therapists, athletic trainers would definitely be the majority of who comes, but there's definite value for people that want to think a little bit outside of the box for how they work through the physical medicine aspect of patient care.
Okay. Now, with every positive modality in the world, there's always, contraindications and people, negative sides. Who might be a contraindicated patient to receive FAKTR treatment?
So again, it entirely depends upon the instrument or the tool that you're going to use, because each one of them comes with their own contraindications. So laser has its own, shockwave therapy has its own, exercise even has its own. So from that standpoint, it's a little bit hard to kind of focus in on the particulars depending upon which modality that you're using. So generally we're looking at health status. We've actually just reworked the course to include more assessment, to include more of the biopsychosocial side of things. Traditionally, FAKTR was very deeply rooted into the biological side, how we're affecting soft tissue, even how we're affecting the neurological side. But now we're really trying to focus in on, what is a patient like socially? What is their psychological status like? So it's a tough question to answer who's contraindicated, but you can look at the simple stuff like, obviously you got to be careful around cancer. We've got to be careful with neuropathies. We've got to be careful with blood pressure and vascular disorders. And then it basically comes down to capability, because FAKTR is very movement oriented. So we certainly don't want to put somebody in a position to do a movement or to load them when it's not quite appropriate. And I think sometimes that creates just a little bit confusion when you're first introduced to FAKTR. When we say we're going to put somebody in a position of provocation, it's not that we're trying to put them in a position that's going to hurt them. We're trying to put them into a position that's provocative to them. So there is definitely a dissemination between provocative and something that's going to create injury. So it's a case by case basis, and we really strive to, when we're breaking down the individual modalities, strive to go over contraindications, some of which I just previously covered, but we try very hard through the classes to make sure that clinicians are using good judgment when they're going to use some sort of modality or exercise on a patient.
So not to ask you to, hopefully I'm not asking you to repeat yourself too much.
Oh, no, go ahead.
Because I know you've alluded to a lot of these things, but I just wanted to ask you to give us like a good start to finish, what a patient can expect. I can give you, like, say, my personal example. I tore my hamstring, and then I was having pain playing running and playing soccer, in college. And I come to you. What is kind of an A to Z? What can I expect in your office?
I'll give you a perfect example. So 2018, I was fortunate enough to attend the Winter Olympics in Pyeongchang.
Mm-hmm.
Did some work with the Nigerian Bobsled and Skeleton Federation, but also had the pleasure of, prior to that, working with a Jamaican Federation skeleton athlete.
Mm-hmm.
And we use him as actually a case study in one of the classes. He's a great example. So when I met him, I was actually teaching a course in Kingston, Jamaica. He was down there training. He's actually Jamaican American. And very long story short, he was experiencing a little bit of hip and knee pain. Nothing you wouldn't expect from somebody that's training at the level he was. I made kind of a blanket offer to assist some of the athletes. At the time I was living in Texas, that if they wanted to come to Texas, we would sort some treatment and living arrangements out. But so he calls me, he took me up on the offer, and he had kind of degraded to the point where he was having a very hard time walking. He was limping, training, everything was just kind of put on hold. And it's significant because that was an Olympic selection year. So if he doesn't get this straightened out, he's basically shot for that Olympics. So long story short, he makes his way up to Texas, pick him up at the airport. He's limping, just really having a hard time. So A to Z, we get him to the office and we go through a thorough assessment. So we cover his entire case history. We go through outcomes assessments, and based upon his case history, I was able to uncover some stuff that was really, he was struggling with. He hadn't been eating well, so obviously there was a very significant inflammatory component to it. His exercise was a significant contributor to his problem. So we go through a very in-depth history. We go through outcomes, and then we jump into the evaluation. So the evaluation is entirely guided by what we find in that history and that intake. So I teach this as part of the class, but I basically have a progression that I go through called VIPI, Ronell, vitals, inspection, palpation, percussion. So I basically put him through the gamut of the things that were germane to what he was presenting with. And why this is important is if I was only focused on his hip and his low back, I would have never caught that he was having some pretty significant low back pain as well. So between the low back pain, the hip pain, the knee pain, and even the groin pain that he was experiencing, I was able to kind of focus into the areas of the spine initially where I know that the innervation basically starts or comes from. So very long story short, after doing a series of hip tests, we could basically rule out that there was a labrum problem. We could rule out that there was a knee problem. We could rule out that there was any kind of adductor problem. And basically through the evaluation and doing some neuro testing. So there was a study that I was able to use where they use a pinwheel or toothpick to look for hyperesthesia instead of hypoesthesia. So through that evaluation, we were able to determine that he was actually having some pretty significant inflammation of the spinal nerves coming out of the thoracolumbar junction. And that's really what was driving his problem. So it wasn't a low back problem necessarily. It was a hip problem. It was a knee problem. It was a groin problem. But the entire thing was exacerbated by bad mechanics, bad lifting form, and inability to properly brace his spine. And it just kind of deteriorated from there. So we were able, through that history, through the evaluation, to determine that it really wasn't where he was complaining about, but it was actually someplace else. And I oftentimes refer to that in class as a victim and a villain, the victim being the place that hurts and the villain being the place that's driving the problem. Mm-hmm. So we were able to put together a soft tissue plan that utilized cupping, instruments, and laser, along with some topicals to kind of get that to calm down. And within about 2 days, we took him from a 7 out of 10 pain down to essentially a 1 out of 10 pain. And we were able to re-jumpstart his strength conditioning program. So because of my background in strength conditioning, we were able to really kind of fast track and push away some of the stuff that, I don't want to say it wasn't relevant, but from a timing standpoint, we needed to really get down to the really important stuff. So from A to Z, depends upon the FAKTR provider's individual trainings. If we've had FAKTR providers that come to class that have a very significant neurological background. So they're heavy into neuro. So they use their neuro training as part of the FAKTR training with the guided laser exercise and eye movements and such. So you get to bring your own flavor to it based upon what your training is.
Absolutely. Absolutely. That was a perfect example, by the way.
Thank you.
Hopefully, sounds like he was better at, I'm sure he performed much, much better
Long
having known
story
you.
short, we got him cleaned up and he made the Olympics.
Awesome. Awesome.
Yeah, there was a little bit of luck and a little bit of uh, perhaps some godly intervention, but yeah, he made it and he got to compete, and
Yeah.
he made history. He was the first Jamaican winter athlete to do skeleton and compete, so it was cool.
Yeah. I'm resisting the urge to make a Cool Runnings pun, but
Oh, you have to. I mean, it's absolutely imperative.
but that's great. That's great. Well, Dr. Riddle, we are just about out of time, but I wanted to make sure we budgeted enough time at the end of the show for you to leave us with any thoughts, any final words
Yeah.
that you might have for us.
Here's what I think is most important, because we're in the position now where we absolutely stay on top of the research from a FAKTR standpoint. And our course continually evolves. Obviously, it was very heavily oriented towards instrument assisted and towards fascia and soft tissue. But as time evolves and as research evolves, we see the very significant neurological component to soft tissue. So we've made very heavy, significant strides to try to incorporate more of the neuro style training. Now, I'll be the first to tell you I'm not the heavily read and taught on neuro yet, but I'm working on that. But we're trying to incorporate some of the neurological aspects of what we do with exercise and try to demonstrate some of the plausible mechanisms behind why instrument assisted works from a neurological standpoint, why we have to take a look at what the brain is contributing to movement and how we can positively or negatively affect that programming through our exercise. So we've really dug deep into the research, and we include a lot of the research and training from Jill Cook or from Ebony Rio in regards to how we can take rehabilitation and have a more of a neuroscience application to it. So for your listeners that are interested in how we're trying to combine a little bit of the soft tissue with the neuro and even with some of the psychosocial, we're really making significant efforts to include all of this and not be so biased in one direction, so much so that we're now developing classes that would take us from the rehab standpoint to fitness for patients as well. So we're really trying to cover the entire spectrum of where a clinician would take on a patient and teach them the appropriate soft tissue, teach them the appropriate assessments, the exercises, and then how to transition them into maintaining that. So maintenance programming.
Mm-hmm. Very good.
Yeah.
And one more time for the listeners who want to find out more about you and other FAKTR practitioners, how would they do that again?
So two websites, FAKTR-store.com and FAKTReducation.com. I am very active on social media. I try to post things that are relevant to what we do with FAKTR and to rehabilitation. So it's not just bent towards chiropractors. It's anybody that works with patients from a conservative hands-on basis. I think it's Dr. Todd Riddle, DC, CSCS on Facebook, Doc Todd 14 on Instagram. I basically let everything else carry over to Twitter, so shouldn't be too hard to find on the socials because I'm pretty active on there.
Awesome. Well, thank you again for coming on to the show today and sharing your expertise on this subject. It was great.
Appreciate it.
Yeah.
This has been a lot of fun. Thank you.
You're welcome. Yeah. Well, from your host, Dr. Joe, this has been the Neuro Wellness Podcast. Be well.